Governor Christie, Governor Hogan, recent, past, and present governors have witnessed the most devastating drug epidemic in our nation's history. Since 1999, more than 500,000 Americans have died from a drug overdose. And the epidemic is escalating. Over the span of nearly 20 years, the death toll has quadrupled with the emergence of even more potent drugs and an ever-expanding online market for illicit distribution. Today, drug overdoses kill more Americans than gun homicides and car crashes combined. That is a staggering reality. 2 out of every 3 daily deaths from drug overdoses in the United States involve an opioid, a class of drugs commonly prescribed to relieve and manage pain. Nationally, over 33,000 Americans died from an opioid-related overdose in 2015, which is an 11% increase from the year before. In South Carolina, where I come from, Greenville and Spartanburg counties in particular, suffered more than 100 opioid-related overdoses in 2015, and while the numbers in the upstate of South Carolina are fewer when compared with cities like Baltimore, behind every number and every statistic is a life with loved ones and friends and potential and aspirations. We have a tendency to use numbers in government and in our line of work, but the victims aren't numbers. The victims are fellow human beings ravaged by the consequences of drug addiction, including the abuse of prescription painkillers. We are a remarkable country of progress and innovation, community, and charity. We can cure diseases that past generations lived in fear of. We can put people on the moon, and we can split atoms. Yet we're struggling with how to respond to this epidemic. I guess we need to start with how did we get here? There are more illicit uses for these drugs, and there are illicit uses for these drugs, and there are illicit uses for these drugs. One is unlawful, of course, the other is legal, but with the potential for abuse and misuse remaining. Physicians have a role to play for certain. These drugs are not available legally without a prescription. What are the pharmaceutical alternatives? Is there overprescribing? Is there sufficient information shared with patients to avoid misuse and abuse? Frequent exposure and easy access to painkillers has led to dependency intolerance, which drives those with a substance use disorder to intensify doses or methods with or without the help of a physician. Addiction to prescription painkillers is growing exponentially. On the illicit side of the equation, malevolent actors are diverting high-potent pills to the black market to be laced with heroin, resulting in drugs so lethal they have been called gray death, a term used to describe the high risk associated with every single injection. Opioid-related overdoses are now deadlier than the HIV/AIDS epidemic at its peak, more insidious than the cocaine-based cocaine powder epidemic that predated it. So there are a plethora of questions to be asked, such as whether we are being as effective as possible in the diversion of these highly toxic substances. I actually like doctors. I happen to be the son of one. But I also prosecuted doctors. And I want to make sure the DEA and DOJ are effectively going to the source of prescriptions issued outside the course of a professional medical practice. Is HHS monitoring insurers placing pricier but less addictive opioids out of reach for patients with acute pain? Or states regulating so-called sober homes, which can move vulnerable patients in and out of treatment, typically for profit? These are the questions our committee and the American people want answers to. The health and safety of our communities all across the nation are at risk. Although almost everything seems capable of being reduced to political exercise in our current environment, I genuinely hope that this epidemic is above that. I hope it's about protecting those susceptible to addiction and punishing those fueling the epidemic. Death, especially the premature death of a young life, has no political or ideological bent. Victims are victims, perpetrators are perpetrators, addiction is addiction, heartache is heartache. The issue to me comes down to those of good conscience earnestly seeking a solution and those of a malevolent conscience bent who profit off of other people's addiction and pain. It's not just the deaths that devastate our families and communities across the healthcare system. It's also the disease of addiction that is permeating and threatening in some places within our country, the very fabric of those communities. At the same time, pain is real. It is real for a home builder in Mr. Cummings' district or mine with immense back pain that can't otherwise get out of bed in the morning without his physician-prescribed pain medication. So how do we solve this epidemic? There's a prevention aspect, there's a treatment aspect, there's an education aspect, there's an enforcement aspect, there's a punishment aspect, and there's an oversight aspect. In March, the President signed an executive order creating a commission consisting of governors and attorney general, mental health advocates, and a professor of psychobiology to recommend policies for the federal response to this epidemic. Earlier this month, the commission finalized recommendations for how the federal government can help states and stakeholders tackle the evolving crisis and stave off emerging threats. Today, we'll have an opportunity to highlight the report, and in Baltimore, and appropriately so. We will also examine Baltimore state and federal partners and how they can assist with and learn from the efforts that are occurring here. The devastating statistics may leave us feeling like we have just left the start line. But our country is resilient, and we have resources, we have compassion. I think we have the commitment to win this battle with opioid and opioid addiction. So I want to thank all of our witnesses. Governor Christie, you are the governor of the great state of New Jersey. As I mentioned to you in the ante room, you're also a former United States attorney, so you are uniquely well suited, and we cannot thank you enough, not just for your presence today, but for your willingness to undertake this vitally important responsibility and role, and with that, you are recognized.